Sudden cardiac arrest, SCA, is a sudden and unexpected event which stops the heart from beating, resulting in immediate cessation of blood flow to the brain and other vital organs. This is a medical emergency that can lead to death if not treated promptly. Sudden cardiac arrest is different from a heart attack, although the heart attacks can sometimes lead to sudden cardiac arrest. During sudden cardiac arrest, the electrical system of the heart malfunctions, causing the heart to beat irregularly, called an arrhythmia, or stop beating entirely. This prevents the heart from pumping blood effectively, depriving the brain and other vital organs of oxygen. Without immediate intervention, such as cardiopulmonary resuscitation, also known as CPR, and the use of an automated external defibrillator, also known as an AED, brain damage and death can occur within minutes. Some causes of sudden cardiac arrest include coronary artery disease, structural heart problems, inherited heart disorders, and electrical problems in the heart. It's essential to recognize the signs of SCA, which can include sudden loss of responsiveness, no pulse or breathing, and gasping for air. Immediate action, such as calling emergency services, performing CPR, and using an AED, can significantly increase the chances of survival and recovery.